Your class is having group work. You happen to be grouped with one boy and two other girls. During the heat of the discussion, the boy suddenly asks you whether or not he's ugly. Confused, you decide to dismiss him and continue to do the work. However, when you are walking home, he insists on asking you again if it's the mole on his face that makes him ugly. This time, you honestly tell him that he's alright, but he seems to be unsure and embarrassed. This behavior of seeking affirmation from others is common in people with body dysmorphic disorder. Body dysmorphic disorder, or BDD, is the obsessive thought of a person about his or her perceived flaws in physical appearance. The flaw seems very significant to them, when in fact others do not even notice it. They fear the imagined negative thoughts of people around them, and in turn develop excessive feelings of shame, embarrassment, and anxiety that they start avoiding all kinds of social situations. The disorder has a similar prevalence between men and women. Signs and symptoms: having a strong relationship with mirrors. Either look at it to check the flaw or avoid it because of the fear of the flaw. Constantly comparing their appearance with others. Try to hide the perceived flaw by skin picking. Using certain styles of makeup or outfits. Continuously assure themselves about their appearances by asking others. People with BDD seek unnecessary cosmetic surgery in most cases. Suicide ideations and attempts occur to 80% of people with BDD at least once during their period of sickness. People with BDD tend to perceive flaws in areas like the face, such as nose, complexion, wrinkles, acne, and other blemishes, skin and vein appearance, and hair or baldness. They have body image distortion, often perceiving themselves as overweight, when in reality they are completely fine. The imagined problem can also be related to genders, such as breast size for women and muscle size or muscular dysmorphia for men. Men with muscular dysmorphia are known to obsessively abuse steroids to achieve the biggest muscle build. In time, prolonged steroid consumption not only can affect your cardiovascular system and cause mood disorders, but also potentially shrink your genitalia, which adds more problem for people with another subtype of BDD, penile dysmorphia. Around 5% of people with BDD are actually aware that their flaws are not real, while the remaining 95% are convinced that they look ugly because of their insignificant flaws. Causes: no one knows exactly what causes BDD. However, recent research suggests some risk factors that could increase the likelihood to experience BDD, such as abuse, bullying, or trauma that they might have experienced, especially in childhood. Low self-esteem or valuing themselves lowly makes them feel that they are not worthy to join a certain group. Fear of being alone or isolated, perfectionism, or being highly competitive against others. Inheritance as BDD is more probable in families with depression, OCD, or BDD. Treatment: before starting the treatment, the patient needs to fill out a questionnaire first to confirm their BDD condition and the severity. Cognitive behavioral therapy, or CBT, is individual counseling that focuses on changing a person's thinking, cognition, and behavior. The aim is to change the patient's point of view on his or her flaw and overcome it. Taking antidepressant medication, such as SSRI, can help, but symptoms may return if the medicine is stopped. And finally, family or group therapy should always be done. Support from the family and close relatives is the key to successful treatment. Family members need to understand the condition and help them to control their feelings. After finishing the treatment, the questionnaire is repeated to check the progress. To sum up, it is normal to seek assurance on our outfit or appearance, especially before an important event in our life. But to stress it out in each and every moment means we need to consult the doctor.